Hello, my name is Xue You, and I'm from Nanjing Medical University in Jiangsu, China. Today, I'll briefly introduce our study on the association of maternal gestational diabetes mellitus and infant visual acuity development. Normal visual function in infants is essential for early information acquisition and neural development. In recent years, the prevalence of visual problems among children has increased globally. Previous studies suggest that several prenatal factors may influence visual development in children. Our previous study found that maternal diabetes during pregnancy was associated with a higher risk of high refractive error in offspring. However, it remains unclear whether GDM influences early visual acuity development, and the potential role of metabolic alterations underlying its association is not well understood. Therefore, in this study, we aimed to examine the association between maternal GDM and visual acuity in infants at 1 year of age, and to explore the potential role of metabolic alterations. We used data from the Jiangsu birth cohort in China. Maternal GDM was diagnosed according to WHO criteria and further classified into 3 types. Infant visual acuity was assessed using Taylor Acute Cut 2. We included 2,139 infants in this study, and about 26.6% was exposed to maternal GDM. We found that infants exposed to maternal GDM had a 70% higher risk of abnormal visual acuity compared with unexposed infants. When we further examined different subtypes of GDM, the association was strongest among mothers with impaired fasting glucose and impaired glucose tolerance. In the metabolomic analysis, we identified distinct metabolic profiles associated with both GDM and infant visual acuity. In particular, pathways related to glycine theory and sodium metabolism were involved in both conditions, suggesting a potential biological link. Several limitations should be also acknowledged. First, residual confounding cannot be completely ruled out. Second, we only assess visual acuity in early infancy, and longer-term outcomes require further investigation. Third, our metabolomic analysis was based on user samples collected in early pregnancy, which may not fully reflect metabolic changes later in gestation. In conclusion, our findings suggest maternal GDM may be associated with an increased risk of abnormal visual acuity in infants, and the glycine theory and sodium pathways may be involved. These findings highlight the importance of maternal metabolic health during pregnancy for early visual development in offspring. Thank you for your attention.